Question 1. A 32-year-old client presents for intake expressing chronic feelings of emptiness, unstable relationships, intense fear of abandonment, and impulsive self-harming behaviors when under stress. During the session, the client becomes agitated, stating, "You're the only one who truly understands me. All my previous therapists were useless." The counselor notes a history of substance use and frequent job changes. What is the most crucial immediate consideration for the counselor in formulating an initial treatment plan? A. Developing a relapse prevention plan for substance use. B. Exploring the client's relationship history to identify attachment patterns. C. Assessing for immediate risk of self-harm and establishing safety protocols. D. Referring the client for psychopharmacological evaluation. Answer: C. Assessing for immediate risk of self-harm and establishing safety protocols. This question tests the counselor's ability to prioritize safety and risk assessment in a complex presentation, particularly when keywords like impulsive self-harming behaviors and agitated are present. While all options represent valid aspects of care, the most crucial immediate consideration is client safety. Before delving into long-term issues or referring out, ensuring the client is safe from self-harm is paramount and forms the foundation of any effective treatment. Always prioritize safety first. If a client is at risk, ensure their immediate well-being before moving to other clinical tasks. Question 2. A counselor is working with an adolescent client who initially presented for anxiety related to school. During sessions, the client begins to disclose experiencing persistent auditory hallucinations and increasingly disorganized thought patterns, unrelated to substance use or a known medical condition. The counselor has limited experience with psychotic disorders. What is the most ethical and appropriate next step for the counselor? A. Continue counseling, focusing on coping strategies for anxiety and thought disorganization. B. Refer the client to a psychiatrist for medication management while continuing therapy. C. Consult with a supervisor or colleague experienced in psychotic disorders and consider a referral. D. Inform the client that they can no longer be seen due to the counselor's lack of experience. Answer: C. Consult with a supervisor or colleague experienced in psychotic disorders and consider a referral. This question emphasizes ethical boundaries and the scope of competence, highlighting keywords like persistent auditory hallucinations, disorganized thought patterns, and limited experience. When faced with symptoms outside one's expertise, the most ethical action is to consult with a more experienced professional or supervisor, which helps ensure the client receives appropriate care while also safeguarding the counselor's ethical practice. This collaborative approach allows for an informed decision about whether the current counselor can continue to serve the client effectively or if a referral to a specialist is necessary. Remember, always consult when a client's needs fall outside your scope of competence. Question 3. A married couple seeks counseling, presenting with frequent arguments, communication breakdowns, and differing views on parenting. During the initial session, the husband expresses frustration that his wife frequently shuts down during disagreements, while the wife states she feels overwhelmed and unheard when he raises his voice. The counselor observes the wife consistently avoiding eye contact when the husband speaks passionately. Which theoretical approach would most directly address these observed interactional patterns? A. Person-centered therapy. B. Cognitive behavioral therapy, CBT. C. Solution-focused brief therapy, SFBT. D. Family systems therapy. Answer: D. Family systems therapy. This question tests knowledge of theoretical approaches suitable for relational dynamics, with keywords like interactional patterns, communication breakdowns, and differing views on parenting pointing towards a systemic perspective. Family systems therapy directly focuses on understanding how individual behaviors are influenced by and, in turn, influence the family unit's dynamics and communication loops. This approach would help the couple identify and change their established patterns of interaction, rather than focusing solely on individual thoughts or feelings. For example, a systems therapist might explore how the husband's passionate communication triggers the wife's withdrawal, reinforcing a problematic cycle. When a problem involves relationships and how people interact, think systems theory. Question 4. A client, who is a recent immigrant, reports feeling isolated, struggling with language barriers, and experiencing discrimination in their new community. They express grief over leaving their home country and frustration with cultural misunderstandings. The counselor observes signs of acculturative stress. What is the most appropriate initial intervention strategy? A. Encourage the client to assimilate completely into the new culture to reduce stress. B. Focus solely on individual coping mechanisms for managing feelings of isolation. C. Explore resources for community integration, language support, and cultural adjustment. D. Diagnose the client with adjustment disorder and begin trauma-focused therapy. Answer: C. Explore resources for community integration, language support, and cultural adjustment. This question highlights the importance of culturally responsive counseling for immigrant populations, with keywords like recent immigrant, language barriers, discrimination, grief over leaving home, and acculturative stress. The most appropriate initial intervention goes beyond individual coping and addresses the systemic and environmental factors contributing to their distress. Connecting the client with practical resources facilitates integration and reduces external stressors, which is crucial before or alongside individual therapy for emotional processing. Remember, for clients facing acculturative stress, look beyond individual symptoms to systemic and community-level solutions. Question 5. A client reveals during a session that they are being physically abused by their partner. The client is visibly fearful and states, "If my partner finds out I told you, things will get worse." The counselor's primary ethical obligation is to ensure the client's safety while respecting their autonomy. What is the most appropriate initial action? A. Immediately report the abuse to Child Protective Services or Adult Protective Services. B. Explain mandatory reporting laws and suggest the client leave their partner immediately. C. Assess the client's safety plan, resources, and willingness to consider options, maintaining confidentiality unless an exception applies. D. Document the abuse thoroughly and wait for the client to bring it up again in a future session. Answer: C. Assess the client's safety plan, resources, and willingness to consider options, maintaining confidentiality unless an exception applies. This question tests the delicate balance between ensuring safety and respecting client autonomy, especially with keywords like physically abused by their partner, visibly fearful, and things will get worse if partner finds out. While ensuring safety is paramount, counselors must avoid immediately taking actions that could inadvertently escalate risk or disempower the client, especially if no immediate and specific threat to a child or vulnerable adult requiring mandatory reporting is identified beyond the client themselves. The most appropriate initial action involves empowering the client by exploring their immediate safety, resources, and options, while maintaining confidentiality unless a clear exception, like a specific duty to warn a third party or child/vulnerable adult abuse, is present. When a client is in an abusive situation, prioritize their immediate safety and empower them to make choices within a confidential, supportive framework. Question 6. A counselor is working with a 15-year-old client who has been diagnosed with major depressive disorder. The client consistently struggles to complete homework assignments, attend school, and engage with peers. The counselor suspects that family dynamics may be contributing to the client's depressive symptoms, but the client's parents are reluctant to participate in family sessions, stating, "It's not our problem, it's hers." What is the most ethical and effective way for the counselor to address this challenge? A. Terminate counseling with the adolescent due to lack of parental cooperation. B. Continue individual counseling, focusing solely on the adolescent's coping skills. C. Educate the parents on the systemic nature of mental health issues and invite their participation in a non-blaming manner. D. Refer the adolescent to another counselor who specializes in uncooperative families. Answer: C. Educate the parents on the systemic nature of mental health issues and invite their participation in a non-blaming manner. This question addresses navigating parental resistance in adolescent therapy, with keywords like major depressive disorder, family dynamics may be contributing, and parents are reluctant. The most ethical and effective approach involves educating the parents about how family dynamics can impact an adolescent's mental health, presenting this information in a supportive, non-blaming way to encourage their engagement. This strategy respects the parents' current stance while gently inviting them to see the broader picture and potentially join the therapeutic process. Remember, when parents are resistant, a non-confrontational, educational approach can often open the door to collaboration. Question 7. During a routine supervision session, a supervisee expresses frustration with a client who consistently misses appointments and shows minimal engagement, despite the supervisee's best efforts. The supervisee admits feeling burned out by this particular client and questions their own competence. What is the supervisor's most appropriate primary focus in addressing the supervisee's concern? A. Reviewing the supervisee's theoretical orientation and suggesting alternative techniques for client engagement. B. Exploring the supervisee's countertransference reactions and self-care strategies. C. Discussing ethical obligations regarding client abandonment if the client continues to miss sessions. D. Advising the supervisee to terminate the client and refer them to another clinician. Answer: B. Exploring the supervisee's countertransference reactions and self-care strategies. This question focuses on the supervisor's role in addressing supervisee challenges, with keywords like frustration with a client, burned out, and questions their own competence. While technique and ethics are important, the primary focus when a supervisee expresses these feelings is often on their internal reactions and well-being. Exploring countertransference helps the supervisee understand how their own feelings might be impacting the therapeutic relationship, while discussing self-care addresses potential burnout, which is crucial for maintaining ethical and effective practice. Helping supervisors recognize and manage their own emotional responses is fundamental to their professional development. Question 8. A counselor receives a subpoena for a client's records from an attorney involved in a custody dispute. The client has not provided consent for the release of information. What is the counselor's most appropriate immediate action? A. Immediately send the requested records to the attorney as legally compelled. B. Contact the client to inform them of the subpoena and discuss their options regarding the release of information. C. Contact the attorney to inform them that the records are confidential and cannot be released. D. Consult with a legal professional or supervisor to determine the validity of the subpoena and the best course of action. Answer: D. Consult with a legal professional or supervisor to determine the validity of the subpoena and the best course of action. This question assesses the counselor's knowledge of legal and ethical obligations concerning confidentiality and subpoenas, with keywords like subpoena for client's records and client has not provided consent. Counselors should never immediately release records based solely on a subpoena without careful review. The most appropriate immediate action is to consult with a legal professional or a knowledgeable supervisor to confirm the subpoena's validity and understand the specific legal requirements, as subpoenas can vary in their legal weight and implications for confidentiality. This step protects both the client's privacy and the counselor's legal standing. Always seek legal or supervisory guidance when faced with a subpoena to ensure you act ethically and legally. Question 9. A client in group therapy consistently dominates discussions, interrupts other members, and offers unsolicited advice, leading to frustration among other participants. The group facilitator has attempted to gently redirect the client multiple times, but the behavior persists. What is the most appropriate next step for the group facilitator to address this dynamic? A. Remove the disruptive client from the group to maintain group cohesion. B. Confront the client directly during the group session about their disruptive behavior. C. Address the client's behavior in an individual session, exploring the function of their dominance and setting clear group expectations. D. Allow the group members to confront the client directly about their behavior. Answer: C. Address the client's behavior in an individual session, exploring the function of their dominance and setting clear group expectations. This question tests the management of challenging group dynamics, with keywords like consistently dominates discussions, interrupts, frustration among other participants, and gently redirect, persists. While the behavior impacts the group, a direct, public confrontation in the group session can be shaming and counterproductive. The most effective next step is to address the client's behavior individually, which provides a private space to explore the underlying reasons for their actions and collaboratively establish clear, respectful group expectations. This approach fosters insight and supports change without alienating the client or derailing the group process. When a group member's persistent behavior is disruptive, individual attention can often be more therapeutic and respectful. Question 10. A counselor is conducting an intake assessment with a 45-year-old client presenting with severe anxiety and panic attacks. The client reports a history of trauma, including a serious car accident 2 months ago, and mentions experiencing flashbacks and nightmares since the event. The client also notes difficulty sleeping and concentrating, and hypervigilance. Based on this information, which diagnostic consideration should the counselor prioritize? A. Generalized anxiety disorder. B. Panic disorder. C. Acute stress disorder. D. Post-traumatic stress disorder, PTSD. Answer: C. Acute stress disorder. This question assesses the ability to differentiate trauma-related disorders based on symptom presentation and timeline, with keywords like serious car accident 2 months ago, flashbacks and nightmares since the event, difficulty sleeping and concentrating, and hypervigilance. The critical clue here is the timeline: symptoms occurring within 1 month of a traumatic event and lasting for at least 3 days, but no longer than 1 month, are indicative of acute stress disorder. If these symptoms persisted beyond 1 month, PTSD would be a more appropriate diagnosis. Remember, the duration of symptoms following trauma is a key differentiator between acute stress disorder and PTSD. Question 11. A client reports feeling overwhelmed by their responsibilities, frequently experiencing muscle tension, irritability, and difficulty controlling their worries about various aspects of life, including work, finances, and family, for the past 7 months. The client states these feelings are just part of who I am. What is the most likely diagnosis the counselor should consider? A. Adjustment disorder with anxious mood. B. Social anxiety disorder. C. Generalized anxiety disorder. D. Obsessive compulsive disorder, OD. Answer: C. Generalized anxiety disorder. This question tests the recognition of generalized anxiety disorder, GAD, symptoms and criteria. Key phrases like overwhelmed by their responsibilities, muscle tension, irritability, difficulty controlling their worries about various aspects of life, and critically, for the past 7 months, strongly align with GAD. The persistent, pervasive, and excessive worry across multiple domains, lasting for at least 6 months, is the hallmark of this disorder, distinguishing it from other anxiety presentations. When you see persistent, unfocused worry across many life areas for an extended period, think generalized anxiety disorder. Question 12. A counselor has been working with a client for 6 months, and the client has made significant progress toward their initial goals. The client now expresses a desire to figure things out on my own and requests to reduce sessions to once a month, then eventually terminate. The counselor observes that the client still occasionally relies on the counselor for reassurance. What is the most appropriate action for the counselor? A. Support the client's decision to terminate immediately, affirming their progress. B. Express concern about the client's readiness and insist on maintaining the current session frequency. C. Collaborate with the client to develop a tapering plan for sessions and a post-termination support strategy. D. Suggest that the client is experiencing resistance and explore underlying fears of independence. Answer: C. Collaborate with the client to develop a tapering plan for sessions and a post-termination support strategy. This question addresses the process of termination and client autonomy, with keywords like significant progress, desire to figure things out on my own, requests to reduce sessions, and occasionally relies on the counselor for reassurance. The most appropriate action is to respect the client's growing autonomy while providing a structured, supportive transition. Collaborating on a tapering plan and a post-termination strategy empowers the client, reinforces their progress, and gently supports their independence, without abruptly ending services or imposing the counselor's own concerns. A gradual, planned termination helps clients solidify gains and prepares them for continued self-management. Question 13. A counselor is facilitating a psychoeducational group for individuals recently diagnosed with depression. During a session, one member begins to share highly personal and graphic details of a past traumatic experience, causing visible discomfort and distress among other group members. What is the most appropriate action for the group facilitator? A. Allow the member to continue sharing to foster openness and vulnerability. B. Politely interrupt the member and redirect the discussion to the group's psychoeducational topic. C. Immediately stop the member and suggest they schedule an individual therapy session to discuss trauma. D. Ask other group members if they are comfortable with the discussion continuing. Answer: B. Politely interrupt the member and redirect the discussion to the group's psychoeducational topic. This question addresses the challenge of managing self-disclosure in a psychoeducational group, with keywords like psychoeducational group, highly personal and graphic details of a past traumatic experience, and visible discomfort and distress among other group members. The primary purpose of a psychoeducational group is learning and skill building, not deep individual processing of trauma. The most appropriate action is to respectfully interrupt and redirect, protecting the group's focus and the emotional safety of all members, while potentially making a note to address the individual's needs outside the group context. In psychoeducational groups, maintaining the focus on learning and skill development is crucial for the benefit of all participants. Question 14. A client reports experiencing persistent low mood, anhedonia, loss of pleasure, significant weight gain, and hypersomnia, excessive sleeping, for the past 3 months. They also mention feelings of worthlessness and difficulty concentrating. The counselor notes that the client often struggles to initiate conversations and seems to move and speak slowly. What specifier of major depressive disorder is most likely indicated? A. with anxious distress. B. With mixed features. C. With atypical features. D. With melancholic features. Answer: C. With atypical features. This question tests the understanding of major depressive disorder specifiers, specifically highlighting atypical features with keywords like persistent low mood, anhedonia, significant weight gain, and hypersomnia. While low mood and anhedonia are common to depression, the combination of hypersomnia and significant weight gain, often accompanied by leaden paralysis, feeling heavy in limbs, and mood reactivity, mood improves in response to positive events, points toward the atypical specifier. Melancholic features, for example, would typically involve early morning awakening and significant anorexia/weight loss. Recognizing these specific symptom clusters is key to accurate diagnosis. Question 15. A counselor is developing a treatment plan for a client diagnosed with avoidant personality disorder. The client expresses a strong desire to connect with others but is paralyzed by fears of rejection and criticism, leading to social isolation. Which intervention strategy would be most central to this client's initial treatment goals? A. Long-term psychodynamic exploration of early attachment experiences. B. Systematic desensitization to reduce phobic reactions to social situations. C. Behavioral experiments to challenge negative self-beliefs and gradually increase social engagement. D. Medication management to reduce anxiety symptoms. Answer: C. Behavioral experiments to challenge negative self-beliefs and gradually increase social engagement. This question focuses on appropriate interventions for avoidant personality disorder, with keywords like fears of rejection and criticism, social isolation, and a desire to connect with others. Cognitive behavioral therapy, CBT, and its techniques, particularly behavioral experiments, are highly effective here. These interventions help clients gradually test their feared social situations, gather evidence against their negative beliefs about themselves and others, and slowly increase their comfort and engagement in social settings. While other options might be part of a comprehensive plan, actively challenging avoidance through behavioral change is central. Encourage clients with social anxieties to test their fears in small, manageable steps. Question 16. A client presents with a history of alcohol use disorder, currently in remission for 6 months. They report strong cravings, especially when under stress, and express concern about relapse. The counselor wants to incorporate a strategy that helps the client identify and manage high-risk situations. Which intervention would be most appropriate? A. Contingency management, rewarding periods of abstinence. B. Motivational interviewing, exploring ambivalence about continued sobriety. C. Relapse prevention planning, including trigger identification and coping strategies. D. Aversion therapy, pairing alcohol with unpleasant stimuli. Answer: C. Relapse prevention planning, including trigger identification and coping strategies. This question targets effective interventions for substance use disorder recovery, with keywords like alcohol use disorder, currently in remission, strong cravings, especially when under stress, and concern about relapse. Relapse prevention planning is specifically designed to help clients identify their personal triggers, high-risk situations, emotions, thoughts, and develop concrete coping strategies to navigate them without returning to substance use. While other options have their place, proactive relapse prevention directly addresses the client's stated concern about maintaining sobriety. When a client expresses fear of relapse, focus on building their proactive coping strategies. Question 17. A counselor is facilitating a group for adult survivors of sexual trauma. During a session, a new member becomes visibly distressed when another member describes their perpetrator in detail, triggering an intense panic attack. What is the most immediate and appropriate action for the facilitator? A. Allow the group to offer support to the distressed member. B. Redirect the member who is describing their perpetrator to cease the graphic details. C. Escort the distressed member out of the group to a private space to provide individual support. D. Continue the group discussion, noting the reaction for later individual follow-up. Answer: C. Escort the distressed member out of the group to a private space to provide individual support. This question tests the ability to manage acute distress and ensure safety in a trauma-informed group setting. With keywords like adult survivors of sexual trauma, new member becomes visibly distressed, triggering an intense panic attack, and graphic details. The most immediate and appropriate action is to remove the acutely distressed member from the triggering environment to provide individual de-escalation and support. This action prioritizes the safety and well-being of the individual experiencing the panic attack while also protecting the group from further distress and disruption. In a trauma group, always prioritize immediate individual safety and de-escalation during an acute crisis. Question 18. A counselor working in a private practice is approached by a former client who is now seeking therapy for their child. The former client terminated therapy successfully 3 years ago, and the child is a minor. What ethical principle is most relevant to the counselor's decision regarding accepting the child as a client? A. Justice. B. Beneficence. C. Non-maleficence. D. Fidelity. Answer: C. Non-maleficence. This question explores ethical considerations regarding boundaries and potential conflicts of interest, with keywords like former client, seeking therapy for their child, terminated therapy successfully 3 years ago, and child is a minor. While the previous therapeutic relationship ended, accepting the child could create a dual relationship or a conflict of interest for the counselor. The ethical principle of non-maleficence, meaning do no harm, is most relevant here, as there is a risk that the counselor's prior relationship with the parent could inadvertently influence the child's therapy or compromise confidentiality or objectivity. It's often best to avoid situations that could create even a perceived conflict of interest to prevent potential harm. Question 19. A client reports experiencing flashbacks, intrusive thoughts, and intense physiological reactions when exposed to reminders of a traumatic event that occurred 2 years ago. They have actively avoided social gatherings and public places since, significantly impacting their quality of life. They meet full diagnostic criteria for post-traumatic stress disorder, PTSD. Which therapeutic approach is considered most empirically supported for this condition? A. Client-centered therapy. B. Dialectical behavior therapy, DBT. C. Eye movement desensitization and reprocessing, EMDR. D. Psychodynamic therapy. Answer: C. Eye movement desensitization and reprocessing, EMDR. This question tests knowledge of evidence-based treatments for specific disorders, focusing on PTSD with keywords like flashbacks, intrusive thoughts, intense physiological reactions, actively avoided, and traumatic event. While several therapies can be helpful, EMDR is widely recognized as one of the most empirically supported and effective treatments for PTSD. EMDR helps clients process traumatic memories and reduce their emotional impact through structured protocols. Understanding which therapies have the strongest evidence base for specific diagnoses is crucial for effective practice. Question 20. A 68-year-old client reports increasing forgetfulness, difficulty finding words, misplacing items, and occasionally getting lost in familiar neighborhoods. Their spouse expresses concern about changes in personality and judgment over the past year. The client is still able to manage most daily activities independently. The counselor suspects early signs of a neurocognitive disorder. What is the most appropriate initial step for the counselor? A. Refer the client for immediate inpatient psychiatric hospitalization. B. Begin cognitive behavioral therapy to address anxiety related to memory loss. C. Conduct a comprehensive mental status examination and recommend a medical evaluation. D. Focus on reminiscence therapy to help the client recall past memories. Answer: C. Conduct a comprehensive mental status examination and recommend a medical evaluation. This question assesses the counselor's role in addressing potential neurocognitive issues, with keywords like increasing forgetfulness, difficulty finding words, changes in personality and judgment over the past year, and early signs of a neurocognitive disorder. The most appropriate initial step involves a thorough assessment of the client's cognitive functioning, e.g., via a mental status exam, and a recommendation for a comprehensive medical evaluation. Neurocognitive disorders often have medical causes or contributing factors that need to be ruled out or managed by a physician before solely focusing on counseling. When presented with potential neurocognitive symptoms, always refer for medical evaluation to rule out physical causes. Question 21. A counselor receives a request from a former client, who is now a successful business owner, to join their professional networking group. The client assures the counselor that professional boundaries will be maintained and that this is a great opportunity for the counselor's practice. The counselor completed therapy with this client 6 months ago. What is the most ethical response for the counselor? A. Accept the invitation, as the client assured that boundaries will be maintained and therapy ended 6 months ago. B. Decline the invitation, explaining that engaging in a dual relationship could compromise professional ethics. C. Accept the invitation but establish clear rules about not discussing past therapy or current business within the group. D. Consult with a supervisor about the potential benefits and risks of joining the group. Answer: B. Decline the invitation, explaining that engaging in a dual relationship could compromise professional ethics. This question tests understanding of boundary issues and dual relationships, even with a former client, with keywords like former client, now a successful business owner, professional networking group, and completed therapy 6 months ago. While the client may have good intentions, counselors must avoid situations that create a dual relationship or could be exploitative, even indirectly. Joining a professional networking group with a former client so soon after termination creates a blurred line that could compromise the integrity of the previous therapeutic relationship and open the door to future ethical dilemmas. When in doubt about boundaries with a former client, it's generally safest and most ethical to avoid any new relationship that could create a conflict of interest. Question 22. A counselor is working with an adolescent client struggling with severe academic underachievement and disruptive behavior in school. The client's parents express frustration, stating they have tried everything. The counselor believes the client's negative self-perception and lack of motivation are key factors. Which theoretical framework would emphasize empowering the client to identify their strengths and resources to overcome these challenges? A. Behavioral therapy. B. Existential therapy. C. Solution-focused brief therapy, SFBT. D. Gestalt therapy. Answer: C. Solution-focused brief therapy, SFBT. This question focuses on identifying a theoretical framework centered on strengths and solutions, with keywords like negative self-perception, lack of motivation, and empowering the client to identify their strengths and resources. Solution-focused brief therapy, SFBT, is explicitly designed to help clients identify their existing resources, successes, and desired future states without extensive exploration of past problems or underlying pathology. It helps clients construct solutions by building on what is already working. When a question emphasizes strengths, resources, and moving toward desired solutions, think solution-focused brief therapy. Question 23. A counselor is part of an interdisciplinary team providing care for a client with complex mental health needs. The team includes a psychiatrist, a social worker, and a case manager. The psychiatrist recommends a new medication regimen that the counselor believes might conflict with the client's cultural values and previous negative experiences with medication. What is the most ethical action for the counselor? A. Defer to the psychiatrist's medical expertise without questioning. B. Express concerns privately to the client and suggest they decline the medication. C. Communicate the concerns about the medication's cultural implications and the client's history to the interdisciplinary team. D. Document the concerns in the client's file but take no further action. Answer: C. Communicate the concerns about the medication's cultural implications and the client's history to the interdisciplinary team. This question addresses interdisciplinary collaboration and ethical advocacy for clients, particularly when cultural values are involved. With keywords like interdisciplinary team, psychiatrist recommends new medication, and counselor believes might conflict with the client's cultural values and previous negative experiences. The most ethical action is to advocate for the client by respectfully communicating these crucial insights to the entire team. This ensures a holistic, client-centered approach to care and promotes shared decision-making, rather than deferring entirely or undermining the team. In an interdisciplinary team, always advocate for your client's unique needs and cultural perspectives to ensure comprehensive care. Question 24. A client expresses strong negative feelings about a specific ethnic group during a counseling session. The counselor, although professionally committed to cultural competence, finds themselves experiencing personal discomfort and a strong desire to challenge the client's views directly. What is the most appropriate and ethical response for the counselor in this moment? A. Challenge the client's views directly to promote tolerance and diversity. B. Refer the client to another counselor immediately due to personal discomfort. C. Explore the client's beliefs and the origins of their feelings in a non-judgmental manner. D. Express personal disagreement with the client's views to model appropriate social behavior. Answer: C. Explore the client's beliefs and the origins of their feelings in a non-judgmental manner. This question tests the counselor's ability to manage their own reactions while maintaining ethical and professional conduct in the face of client prejudice, with keywords like strong negative feelings about a specific ethnic group, personal discomfort, and strong desire to challenge the client's views directly. While challenging harmful beliefs is important, the most appropriate immediate ethical response is to remain non-judgmental and therapeutically curious, exploring the client's perspective and its origins. Directly challenging or expressing disagreement can create defensiveness and rupture the therapeutic alliance. Professional counselors explore, rather than confront, problematic beliefs to understand and potentially facilitate change. Question 25. A counselor is reviewing their caseload and notices a pattern. Clients from lower socioeconomic backgrounds are consistently less likely to attend follow-up sessions and often report difficulty implementing coping strategies. The counselor has been using standard, evidence-based interventions without significant modifications. What is the most important consideration for the counselor in addressing this pattern? A. The clients may lack motivation for therapy. B. The counselor should provide more intensive, frequent sessions for these clients. C. The interventions may not be culturally or contextually appropriate for these clients. D. The counselor should refer these clients to community mental health centers. Answer: C. The interventions may not be culturally or contextually appropriate for these clients. This question highlights the importance of cultural responsiveness and systemic thinking in counseling, with keywords like clients from lower socioeconomic backgrounds, less likely to attend follow-up sessions, difficulty implementing coping strategies, and standard, evidence-based interventions without significant modifications. When a pattern of poor engagement or effectiveness emerges across a specific demographic, the most important consideration is often whether the interventions are appropriately adapted to the client's unique cultural, socioeconomic, and environmental contexts. It's crucial for counselors to examine their own practices and adapt interventions to be more accessible and relevant to diverse populations, rather than attributing the issue solely to client factors. Always consider how your approach fits the client's lived experience, not just whether the intervention is evidence-based.